This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back. If you own a business, you got a lot going on, a lot of responsibility, even if you're responsible for a team. And many times you have questions, you wonder about certain things to improve your business, improve the bottom line. Sometimes you need help. I've got it for you. And that's in the form of a coach and business consulting firm. And today we're going to focus on the medical arena. And a lot of things are similar in many different businesses. Medical, there's also very specific things that need to be addressed to get things just right. And she is the woman behind Just Right Business Services. Laurel Jones is back on the program with us. Hey, welcome. How are you doing today, Laurel?
Hi, Steve. I'm doing well. Thank you.
Thanks for being here. And the medical community, bigger than ever, aging population, a lot of smaller firms being swallowed up by bigger firms. Doesn't matter the size, though. They're all dealing with a lot of the same challenges within. Where should we begin today? And we'll get to a white paper that you're going to be releasing for this very soon. But where should we start here in helping out some of these medically connected businesses?
Those businesses that deal with billing, healthcare billing, and insurance reimbursements, that billing can be very complex. So let's start there.
Now, when you say billing, I guess it's twofold. It's billing the patient and then billing the insurance company then, right?
It's actually the opposite order. It's billing the insurance company and then getting the difference from the patient in either a copay or co-insurance form. Yes.
There's so much to keep track of. And I feel this is my personal feeling, the insurance situation in our country right now is a mess. It just,
Agreed.
yeah,
Agreed.
there's a lot of mistakes made. There's a lot of lag time, miscommunication back and forth. What would be the number one thing that you would suggest to a medical organization to make sure that they reclaim or claim the most amount of money?
Making sure that their billing is coded appropriately to the respective insurance agencies, and making sure that they are using systems that are interoperable, meaning that they don't have systems that require a human to intervene before the information gets from their personal system to the CMS system or to any other billing or engagement system that they would use in the market for getting paid. Okay. Those are two of the biggest problems. And because there's still a lot of legacy systems out there, and when I say legacy systems, systems that were obtained in the 2000s, the 1990s, the 1980s, those systems still exist because they hold a lot of information that has not been upgraded or updated to the modern standards, the HL7 standards. So the interoperability and making sure that you're billing the right codes and getting the appropriate reimbursement and responding when you get denials. Those are some of the key things, but it requires an audit. In essence, doing an audit of your billing system from end to end.
My gosh, let's go back to the antiquated software or system. Can you repeat that again? Because that is just hard to believe that some of the older systems are still in use. And I get it, transfer data over. But what are we talking about here? And in your estimation, percentage-wise, how many businesses, practices are still using antiquated systems?
Consider the fact that you've got graduates happening all the time, but then those people that started their practices in the 1990s, the 2000s, they bought systems that were applicable for that time. Since then, Medicare has required or has given some standardized requirements for all of the systems. So then because these newer systems have a significant price tag on them, a lot of times you can find Band-Aids or intermediaries to bridge the gap between the existing system that I have, which has information that I need, but the new system might be missing a few fields that are very important to my business. So I'm going to create this bridge. That bridge might require a human now going in to make sure that the information transferred appropriately. And that transfer may or may not have been successful, and then validating it that it was received. So there's a lot of opportunity for error and
Wow.
delay.
And delay. Yeah, I can totally see that. It's almost like it's a very expensive Band-Aid.
It is, but it's less expensive than buying the new system. Okay.
Yes, even if that includes an employee that has to sit there and recode or just fill in the fields so
It's
that it can
called
be pushed
rework.
forward.
Yes.
Wow. When you
Yeah.
begin with a company and you, I get it's almost I'm getting a picture of you're the mechanic opening up the hood and looking in and seeing, well, let's take a look at the engine here and see what we got going on. Does it kind of feel that way?
It does, but we always start with the pain points. Where is the owner or the lead practitioner or executive feeling the pain point? Is it a delay in getting reimbursement? Is it slow reimbursement? Is it your electronic health records? Are they being managed effectively? Are your is your customer data coming back from the respective accreditation agencies acceptably? Now, that's another one that a lot of people don't pay attention to, but getting good survey results from, I believe it's the CHAPA or PS, one second, but it's one of the accreditation agencies. But if you don't get the accreditation from NCQR, that's the quality, and then the customer feedback is from the other agency. If they don't come back favorably, that can directly impact your reimbursement from Medicare and from Medicaid. So
Hmm.
those things also tie into billing and the response or the satisfaction of the people that you're serving, but also making sure that you're billing appropriately.
What is your opinion in terms of the time frame? A service is rendered, medical service rendered, of course, got to insurance, and then maybe to the patient has to pay. What is a reasonable expectation in terms of time frame for the practice to get paid?
Reasonable time frame in today's society is about 10 days if they have the coding appropriately and the coding appropriately and the systems. Now, if you've got an Epic system where you've got your clinical and your financial systems all communicating, within 10 days you should have a reimbursement or at least a notification of what your reimbursement will be and what the client owes or patient owes or what's written off. That's ideal. That's when you have paid for those nice systems that are completely integrated. But these cottage providers that are good at what they do, but not that great with technology, and they have loyal people who've been with them for a very long time that are already working frenziedly to keep up with everything. They don't really have a lot of time to look forward as far as what's the best system for us today. How
Hmm.
can we get this money in here quicker? Are we all really doing the work that we need to be doing in order for us to be accredited like we need to be? Are our clients getting the care that they need? Are they meeting the HEDIS, or another accreditation requirement with the immunizations, the mammograms, etc.? Those things matter. But like I said, if you're dealing with your admin day to day and your turnover and problems that come up with your regular operations, those things become secondary.
So I want to peel back the curtain a little bit in terms of the billing situation. And you talked about writing off certain things. What's the determination there? Is there a certain amount that practices typically write off when it goes to the patient, waiting for the patient to pay? Maybe they don't, that kind of situation.
Well, there is a tip right now with our current system. The patient has the right to know what they will have to pay for services, depending on your respective plans. So that can be a cut and dry. But the question becomes more valid when you're having cosmetic or experimental things done to you. For example, a butt lift might be considered cosmetic, and that would come straight out of your pocket.
Hmm.
That's when the doctor might charge insurance $6,000, but because you're paying out of your pocket, he might charge you 4,500. Insurance company might not ever find out about it, but if they do, that's a problem. So and then there are several that are in such a field like the cosmetic surgery and things that are sometimes we choose to do that won't accept insurance. Chiro is another, a lot of chiros don't accept insurance because of the problems and the challenges and have the having to go back and forth to get their money.
You are so on point. I just went to a chiropractor like 2 weeks ago with a Groupon. It was a recommendation from somebody else, and yeah, he doesn't go Venmo me, and that's how it is. And it's reasonable rates. Um, Great person, love going back there. And yeah, to your point, it's so interesting. Let's pivot over to staff turnover and retention.
Mhm.
This is a big category, and in my view of things, can even give examples. These practices aren't holding on to their employees like they used to, right?
Well, that's a part of the challenge, but it's also finding the right challenge and making sure that they're trained appropriately on what's expected of them. A
Hmm.
lot of times, what I have seen is that people have a job and they just come to a job. But when they start to feel like they're a part of a team, that makes a difference. And when they realize what they're responsible for and how what they do ties into the overall flow of the work, how it directly, even though they might indirectly be a part of the process, impacts the patient's response to the surveys that they're going to get, how they are a pivotal part, then it matters to them. And then they can start to, especially if they've got some benefits, they can start to assimilate. But until you start to treat people and like they have a purpose and making clear the expectations and holding up your end of what you agree to as a leader, then you'll start to see the retention change. But that's one of the benefits of working with Just Right Business Services is because we also are considered culture shifters because we use everything DISC to do the assessments so that the employees start to understand themselves and the people they're working with better. That's kind of like our foundation when we go into a situation and there's high retention and the people there are kind of not talking to each other, but more at each other.
Hmm. You're so spot on and to illustrate. That's the right way to do it. The wrong way to do it would be a very close friend of mine who has done medical billing for years, took a little bit of break, personal situation, got back into it last year. And this, I'm going to tell you exactly, I don't know if I ever shared this with you, but they told her when she went in for training, the first thing they said, actually before she even got the job, they said, wow, you came back after lunch. Usually people don't come back. That was the first tip off. Then when the training began, they said, if you have any questions, don't ask. Not even kidding. And there it started going downhill in terms of her learning what the culture was, people talking about how they just don't enjoy working there. They would throw a holiday party in the office and the employees didn't even want to go. Like just we'll just keep working or instead of buying trays of lasagna and ziti, just throw us $25 a bonus and we'd be happy. We don't, thank you, but nobody wanted a part of it. Um,
Yeah.
to the point even where she was told that she wasn't making her numbers in terms of medical billing, and they were screwing it up and giving another employee credit for her work. It was revealed. She eventually left that company, but that's what's going on. And this is a one of the bigger medical entities in the New York metro area. I'll just say that it's not a little tiny company, and this is what's going on out there. Just
Well,
so wrong.
that ties back to the technology, okay?
Mm,
And them giving credit for the work that she did to someone else, something was not aligned or mapped appropriately there. And as far as the communication with her, as far as the training, that is sad. Okay, that is very sad, but common because they have competing priorities. yes, I have to get you through training, but yes, I have to get my reports out. And yes, I have other things that I need to do by the end of the day, by the end of the month. And you are just one of the pieces. I really don't have time. Okay.
Mm,
And that's where the co chief operations officer, fractional, that's what we provide. Whereas we can come in and help your people understand where they fit, help them to understand their role, and be a source for getting all of that information so there's not 10,000 people coming to this one person who's trying to do 10 other things by the end of the week. Okay, so that
yeah.
they can spend that time with that one person and have a whole list of everything. So that's a part of our offering as well as fractional COO.
Huge. And by the way, one other thing I detect, based on what this person, my friend told me, that that person, everything you said, spot on. And I think there was also a little piece of don't let,
Jealousy.
yes, don't let this person look better than me, i.e., the person in charge.
And yeah, we can't control other people's perceptions, but yeah, that is very valid.
Mm,
Very, very valid.
oof, wow. What are some ways to retain employees? Anything stand out for you?
Yes, as I said, we start with the DISC assessment so that folk
Mm.
can understand themselves and the folk that they're working with. But we've also partnered with the Aspire group, and we have a wellness package. And that wellness package sits on top of the employee benefits that the group might already have, but it allows the employer to save up to $600 per year per employee. And it also provides free services, free primary care, free urgent care as a wellness package. So it can be applied with pre-tax dollars. That's how the employer gets the benefit. So we have different ways of benefiting the employers once we get in and understand what they're working with, especially with that retention, because we've also found out that debt and the stress of debt can also be a factor in why people leave. If you're paying me $5 and I can get 5.50 over here, I might be able to pay off this bill. I might so stressing with debt. We also our partnership also affords us the access to My Debt Navigator, who is a debt resolution agency, and they have attorneys across the country. So we work with our employer, and it doesn't cost neither one of those programs cost the employer anything. It's an access or a benefit for the employee. And the wellness plan actually puts money back in the employer's pocket. So those are two of the things that we can do in addition to our project management process improvement, but we can actually help the employees feel like, okay, I want to stay here because I can get this assistance here.
Just feel valued be my starting point with a lot of companies. And I'm seeing it, we've gotten together a few times, but today I'm truly seeing it as if you're part of the team. And as, let's say, practice administrator, somebody in charge, I'm going to take the ball and I'm going to throw it to you. And then you're going to run down the field and take care of these things that maybe I don't have time for, maybe I don't have the infrastructure for, the staff to take care of effectively. Here it is. Take it off my plate. That's what it's
You're
looking like.
exactly right. And then as soon as we are finished, if you're satisfied and you don't want to play with us anymore, cool. But we'll be here when you need us again. But
Hmm.
we deliver on what we say we're going to do.
With the few minutes that we have,
Mhm.
anything else, pain points that you address? And we talked about billing and reimbursement delays, the staff turnover, retention. What else is something that is in the forefront when you work with medical practices?
Is the poor patient experience, meaning that the doctor has come in and met with the patient and updated the record, but when the patient was arrived, they really didn't feel like they were heard. When the patient spoke with the doctor and said what they felt, the doctor didn't acknowledge that it could possibly be and dismissed it and said, "Well, just take this and go." So,
Hmm.
and then when they complete that survey from CMS or from the quality center, they're going to be saying, no, I was not satisfied with my visit. And no, he did not ask me the appropriate questions to find out if I understood what he said to me. Those are some of the basics. So making sure that the patient's experience from the time they walk in, the time with the provider, and when they're leaving, that everything is clear, those things are pivotal. And a lot of times, because you might have a line of patients and you might have a backlog, you don't take the time to pay attention to the one who's going to fill out that survey. But everybody is important.
Wow. And I believe the average is 11 minutes with the doctor, and that includes the hello, goodbye, and maybe a couple of standard questions. So now pare it down to maybe 8 minutes that you have with the doctor.
Because they also have to update those records in the system,
Yes, they do. Yes, they do.
Yeah.
Unrelated but related. Let's say you go to the doctor. You're not happy with the service. Maybe the diagnosis was wrong or whatever. You're just not satisfied.
Mm-hmm.
You go to a restaurant. You're not happy with the meal. You may say, "Listen, doesn't come. Can I order something else?" Or maybe you don't tip as much as you normally do if the service is not up to your expectations. What's the recourse when you go to a doctor?
Change.
You still have to pay, though.
You still have to pay. However, there are many systems on the internet that will show you WebMD, and there are some other ones that will show you the doctor's rating. They will also give you the history, showing you where they went to school and their credentials, if they were board certified or not. And there are also sites that will show you the docs that are in the midst of malpractice situations. So pay attention. You don't have to accept the doc that was assigned to you randomly by the computer.
That's the biggest challenge because a lot of these companies, they've swallowed up the little doctors, and you make the appointment. Half the time you don't even know who you're making an appointment for, and you really got to do your diligence, like you said, even writing down the name. I'm going to see Dr. Jones. Yeah, it seems like it falls back on the patient. You are your best advocate when it comes to medical.
Precisely. Precisely.
Thank you for all this insight, Laurel. This is impactful, especially if you have a practice. And, on the other side, from the patient side, maybe a little bit surprising that a lot of the inter-office technology is a little outdated. And stands to reason why there's a lot of errors.
Indeed. When we humans have to get involved, there is possibility for error at every point. That's why we train machines.
Well, now we enter AI, and if you look at any research on AI, and I look at it, I study it all the time, the number one thing that always comes back, yeah, it's great, it's fantastic, you got to watch it.
Exactly.
Do not put it on autopilot in any capacity. You cannot. How do we find you? Let's go to an actual live person that wants to help your business, medical or not, move forward. What's the best way to start the conversation, Laurel?
They can reach me at Laurel, Laurel, at justrightbusinessservices.com. Just spell it all out. Or they can contact us via our website at www.justrightbusiness, and services is SV as in victory, C as in cat, S.com. So either way, but Laurel at justrightbusinessservices.com, coming straight to me.
Thank you for today. What an eye-opener this has been. And I truly appreciate you and what you do. And again, I've said this before, I love the name because this is what we want as business owners. We want to get it just right. And this is what you provide. Have a great weekend. We'll talk soon, okay?
Thank you, and happy holidays to you.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.